Hi, my name is Morgan Miller and I'm a student at the MUW BSN program. Today we are going to talk to you about dyslipidemia coronary artery disease. Just some objectives. By the end of this presentation, hopefully you will have learned what the pathophysiology of this disease is, some signs and symptoms, and some how to diagnose it, and hopefully the prognosis. The pathophysiology of dyslipidemia is just basically abnormal cholesterol or fat levels in the blood. Most of these will be elevated, and dyslipidemia eventually can lead to coronary artery disease. Now, what coronary artery disease is when plaque builds up in your arteries and it can cause a decreased blood flow. Here is just a picture. Here is a normal artery. So there's nothing here blocking it. And then here is a plaque buildup artery. You can see how you only have about half of the artery that is being able to pump blood to your heart. And here's the plaque right here. So this one is getting normal blood flow, and this one is getting a pretty good amount decreased blood flow. Some signs and symptoms to look for. Sometimes you can be asymptomatic. You don't have any signs and symptoms whatsoever. Basically, they'll only find it just because they were doing a routine health check. Some other signs and symptoms you can have are chest pain or angina, which chest pain can be characterized as a tightness in your chest, a pressure, a heaviness. It can be dull, it can be sharp. It can also radiate to your arm and your jaw. Another sign and symptom is shortness of breath. And most of the time when you're having that chest pain, it's more than likely that you're having a heart attack, so make sure you go to the ER. Another sign and symptom is tachycardia. So how to diagnose this? You'll get blood lipid levels. That we're going to check your cholesterol. You'll just go to the lab, get some blood work done. That's it. Like I said, most of the time these levels will be elevated. Another way to diagnose is with the EKG. How you'll tell with the EKG is basically because when your blood flow is reduced and ischemia occurs, your ST segment could be depressed. It will most likely be depressed, or your T-wave inversions are noted. The ST segment can return to normal once your heart is getting the normal blood flow back. An echocardiogram, what that is just an ultrasound of your heart. We'll use that to determine your EF, ejection fraction of your heart, and a stress test. That can be a nuclear Lexi scan, a dobutamine stress test. Then you also have a cardiac catheterization. Now what this is basically they'll go in through, normally they go in through your femoral artery. They'll just kind of go in, shoot some dye into your arteries, and they'll have it on the screen, so they'll be able to see how well the dye is pumping. If it will show a blockage or stenosis in your heart, or in the arteries. This is the best way to diagnose CAD. It would also show the presence of arteriosclerosis. And with the cardiac cath, the patient may receive a percutaneous transluminal coronary angioplasty. What this is, it will just kind of be a little balloon which will compress the plaque against the walls of the artery to dilate the vessel, so your blood will be able to flow. They might also get a stent placed, and you can also diagnose with a heart scan, like a CT or something like that. Now this is just showing how they stent. Here is your clogged artery, and this is what they go in. This is the catheter that I was talking about. They would go up through your artery. They'll with the balloon and the stent around it. They'll blow up the balloon and pull, and deflate the balloon and pull it out, and it will leave this stent. The stent just stays expanded so your blood flow can flow normally. Prognosis. An estimated 15.5 million people in the U.S. have coronary artery disease. Each year, 1.5 million patients suffer from acute MI, and more than 600,000 people can die from this. It's always better to just have your routine health exams so that they can diagnose it early and it can be treated early. Okay, that is it. Thank you for listening. Now Abby Smith's going to come up and talk to you.
Hey, I'm Abby Smith. I'm also in the MUW BSN program, and I'm just going to talk to you about dyslipidemia and coronary artery disease. So by the end of this presentation, I hope that you'll learn the ethical issues concerning CAD, along with the impact of the disease process on the patient, family, and their social interactions. Okay, some ethical issues. Patients that are unable to afford medications, they just never get them filled, or they get the samples from the doctor, and then after those run out, they just don't ever go back and get them filled because they can't afford it. Another ethical issue is patients might deny the medical care they need because of religious issues, such as if you do need a CABG, if the heart disease gets so severe that you need a CABG, you know, Jehovah's Witnesses won't be able to do that. And then some patients can't afford the heart healthy diet. The heart healthy diet would be an aim to decrease the serum cholesterol and the triglyceride level, which is like a low fat, low cholesterol diet, which is typically more expensive than if you would go to like McDonald's and get off the dollar menu. You know, is the healthier option is a little bit more expensive. Okay, living with coronary artery disease. Effects that heart disease can have on life. Heart disease is a lifelong illness. Once you have it, you can't get rid of it. You just have to kind of live your life around the disease. It's truly a life-changing condition. It alters the physical, social, and emotional aspects of your life. Some physical issues. Some patients that are diagnosed with heart disease will have to decrease their physical activity to decrease the workload of the heart. Now, if they're used to doing strenuous activity, they might just have to stop a little bit and do a little bit lighter activities. And with this it might depress the patient, know that they have the disease and they can't do everything that they used to do. Some emotional issues. CAD may cause anxiety, fear, and stress. They just might be worried about their heart problems. They might have anxiety about their social changes, their lifestyle changes that need to be made. And having depression or anxiety will aggravate the condition of the patient. So it's very important that you provide not only physical care, but also emotional support for the patient during this hard time. Social life and heart disease. Patients who usually enjoy drinking alcohol with their friends will have to stop. This also includes social smoking or either smoking in general. We advise you not to do that. Some patients' heart disease is so severe that they actually have to stop working because their heart cannot manage the extra physical work. And this can also be a damper on family, because if this person was the income provider of the family and now they have to kind of cut back, that might kind of stress things out a little bit more. So if they have to stop drinking, they're not used to going out and have, drinking and smoking, then that could cause depression because now they don't have very much social interaction. So the best way to resolve this is to let them join organizations with patients having the same conditions that they have. Support options. There's patient support groups. If you can't actually go to one, if your community don't have this support group, there's multiple ones on the internet you can find. So it's just easier if you are around a group of people that have the same symptoms, so you can kind of learn ways to cope and release some of the anxiety about it. Family support is also a very huge deal. You need family support. It will help reduce stress and anxiety. So with family, they can kind of, work with this patient or this family member that has CAD. They can help them quit tobacco or be an emotional support for that. They can be more active with them, and they can also, as a family, choose better nutrition. Tobacco smoke and stress increases blood pressure. The physical activity can help lower cholesterol levels, help with blood pressure. All this is just overall helps with the condition, or minimizes it. So this is it. Thank you for listening. I hope you learned something.